Good evening, I am Dr. Chandra, MT General Medicine. Our today's topic is dengue hemorrhagic fever. Okay, the why we have chosen this topic is there is actually there is a surge of dengue cases throughout India, mainly in Hyderabad and Delhi. We are observing little surge of dengue cases as the spectrum is overlapping with the corona in very one or in the initial period of the disease, like first day we are getting something like high grade fever. So many people are worried about the new incidence of corona wave or some delta variant, kappa variant and all. I'll try to make another video regarding those variants and all, but now we are restricting ourselves to discussion about dengue fever. As there is much awareness about the health last 1 to 2 years, every disease is being watched very carefully by household people and parents in case of mainly children. So I thought that we need to give some knowledge about the fever so that they can be give proper services to their kids, and they will be like little bit fearless if this can help them, right? Thank you. Dengue fever is an acute febrile illness caused by several arthropod-borne viruses. It's characterized by biphasic fever, myalgia, arthralgia, rash, leukopenia, and mild lymphadenopathy will be there. And the classic fever of dengue will be it's like saddleback fever. First 1 or 2 days the fever will be like 103, 104. Sometimes it may go to 105, 106, but theoretically it will be 106, but very rarely it touches above 104. And after 2 or 3 days of defervescence, then the fever starts again. This will be the normal process of dengue fever. Normally we classify dengue as probable dengue, dengue with warning signs, severe dengue, long form and short form. Why we are classifying a disease as probable dengue? Because in dengue tests normally you will have NS1 antigen and IgM antibody and IgG antibody. Normally these people are well aware of about antibodies and all after these vaccination campaigns, so I am mentioning this in a general talk. Normally in first 5 to 6 days of fever, dengue IgM may be negative. Okay, so we use NS1 antigen to diagnose the disease, right? If this NS1 antigen is negative, even though this is negative, if the symptoms are correlating with the dengue fever, we will consider it as a probable dengue, right? Because NS1 antigen, NS1 AG will have many false positives and many false negatives, and IgM and IgG values will be depending on the present infection and also the previous infections also. Sometimes IgM antibody may persist for 3 or 4 months after the acute infection, so that may interfere with the diagnosis of the present disease. So symptoms are very most important, and there is nothing to fear. This is not an airborne disease, and this is not didn't cause any pandemics previously, and it is not going to cause also. There may be rise of cases, maybe hospitalization if God forbids, but it will be like little safe disease when compared to coronavirus. And this is being causing disease epidemics and endemics since 2006 in India. It is properly taken care of, and to be specific, there is no specific antiviral drug for dengue also, and this is not needed in case of dengue. Okay, dengue will be causing a typical syndrome of features. It's a syndrome. Dengue is a syndrome causing a group of features like I will discuss them later. It's like probable dengue, dengue with warning signs, severe dengue, and dengue in severe dengue, short form and long form, right? What is probable dengue? Patients with probable dengue will be at home. Dengue with warning signs will be under close watch. Okay, if affordability is there and parents are insisting for admission and the person wants to take admission, he monitored at hospital, they can be hospitalized. Dengue short form or long form of severe dengue, they should be hospitalized, right? As the health awareness and knowledge of the people is going up, so better be very transparent in the information about the diseases and all. So I am using some of the medical terms in this discourse, right? Probable dengue is like patient lives or travels to the dengue endemic area and has fever which is high grade, something like 102, 103, 104, and has the following features like nausea, vomiting, rash, aches, pains, positive tornic test. Tornic test is like if you tie a towel to your forearm or upper arm for 2 or 3 like 10 seconds or 15 seconds. If you get some spots over that, that is called positive direct test. This should not be done at home, and there is no need for it. Leukopenia, if you get a CBP done, if there is WBC count is little bit low, okay, this is like one of the probable signs of dengue, right? It's a probable signs of viral infection. In this background, we can consider it as dengue. What is dengue with warning signs? Abdominal pain or tenderness or persistent vomiting, clinical fluid accumulation. Fluid accumulation means it's like swollen legs, face appears swollen. These are the fluid accumulation signs, right? Mucosal bleed means you may have some gum bleed, or you may have some black stool, okay, red conjunctiva. Those are the other things. Lethargy and restlessness, and you feel like not feeling like going to office, or not feeling like watching TV and all. You will be like restless little bit. And liver enlargement and laboratory features of some CBP abnormalities, those will be taken care by your doctors. And severe dengue or dengue short form and long form, in this there will be abnormalities. If you observe any of your household patients who are diagnosed as dengue, they are observing like, is there any swollen feet or anything rash at the ankles which is not itchy, and it is not it is not blanchable, okay, and the patient is like having diarrhea or constipation or persistent vomiting, little bit dehydration is there, better to consult a doctor immediately, right? This is a like normal course of the dengue. And how we will monitor a dengue patient? We will monitor a dengue patient with some 2 or 3 lab parameters, because when the lab parameter is abnormal, it will cause a symptom. If you want to wait for a symptom to occur, that is one kind of treatment. Or if you proactively monitor with some reasonable cost tests, something like CBP and LFT, that's another kind of approach. Normally, if you got a fever, normally first day or second day you will try paracetamol, then you will consult a doctor on the second day or third day, right? So after we start paracetamol, with the paracetamol 2 or 3 doses, there may be a reduction in the temperature, and patient may feel comfortable after taking paracetamol and all 2 or 3 days. Then after a period of a gap of 4 or something like 5th day or 6th day, you may develop a rash like non-dependent areas, something like on the forehead, on the elbows, and the like forearms and the chest and all, which is blanchable. Okay, that is a normal finding that may be associated with some itch. Okay, this is the normal course. After that, what are the signs of severity, that you should be knowing, right? It's like persistent abdominal pain. If you press on the abdomen, the patient is feeling like little bit tenderness or pain, and persistent vomiting, ankle swelling, or any something like bleeding from the natural orifices, and black stool, okay, and the patient is lethargic, better to consult a doctor and better to be hospitalized. After hospitalization, the tests that are needed are something like X-ray, ultrasound abdomen and chest to note something like anything like fluid accumulation in the chest, we call it as pleural effusion, and in the abdomen we call it as ascites, right? These are the 2 or 3 things that should be monitored at the hospital, and accordingly the treatment will be given. And home monitoring the patients after corona, the treatment has changed drastically. Every patient is actually preferring the home based treatment, as the corona wave is still progressing. It's like something like 50,000 cases are there, but here and there some spots of corona hotspots are there, so most of the patients are not willing for hospital admission. Can we monitor at home? So this is the main idea of this video, is to guide the patients who are being watched at the home by relatives, and to make them like comfortable, right? If you first day of fever, you will be having high fever, you take paracetamol, you should take fluids. Then next day you consult a doctor, prescription will be given, antibiotics will be very rarely given, but based on the discretion, associated conditions, the WBC count, platelet count, the decision will be taken. That should be individualized. And third day, fourth day, you may be comfortable, little bit dehydration or some vomiting may be there, some rash may appear, okay, then consult your doctor. Is it related to reduced platelet count, or it is related to some normal viral replication? Then on 4th day, 5th day, you will be fine. On 5th day, 6th day, 7th day, you may get a fever again, fever spike again. Then it is the time. Every third day you should be monitored with CBP, LFT, something. If you are affordable, RFT electrolytes can be there, as persistent vomiting is there. If there any electrolyte abnormality, that can be corrected immediately. And what is the treatment? As the doctor is saying, there is no special antiviral agent. So how the virus can be tackled? Most of the antiviral diseases normally, better to know, this is like bacteria will be, if you consider X number of bacteria is causing the diseases, there are some 2x to 3x number of other parasites or fungus causing the diseases. It will be like 10x to 100x is the virus that are existing in our environment. If there is proper environment on the host, so there may be viral replication occurring inside your GI tract. You may not be knowing even the virus exists. When there is imbalance between that, any virus can cause a disease. So if you go on like preparing an antiviral drug for every virus, it will be very difficult to handle the situation, because virus itself cannot cause any disease. When it is involving our human cells only, that can cause a disease. So if you are killing the virus means in some form or other you are damaging your own body. So unless otherwise pretty much needed, it is not advisable to give any antiviral drugs in any virus. So viral treatment should be individualized. As far as dengue is concerned, the mainstay of treatment is fluid management. Dehydration should be prevented, hypotension should be prevented, and when there is lethargy, proper mechanisms for the lethargy should be assessed, something like electrolyte abnormality, liver damage, something like encephalopathy, that should be handled in that way, right? Mainly in a nutshell, in-home management is like mainly from day 1 to day 6 you should be very careful. In that, at least two times every third day you should be monitoring your CBP and LFT. Be in touch with your trusted physician and follow the advice. Over enthusiastic use of fluid management or enthusiastic use of antibiotics may cause harm rather than benefit, right? Thank you.